An early miscarriage is a term used to describe a pregnancy loss that happens within the first 13 weeks of gestation. It's an experience that's far more common than many people realize. And honestly, it often occurs so early that a woman may not even be aware she was pregnant. These very early losses, sometimes mistaken for a late or heavy period, are known as chemical pregnancies. Understanding the fundamental nature of this process is really the first step towards navigating the complex emotions that come with it. It's a deeply personal event, but it's also a biological one that affects millions of women and their partners across the globe every single year. The sheer prevalence of early miscarriage can be staggering, but it's important to bring these numbers into the light to normalize the conversation and reduce the sense of isolation so many feel. Research suggests that as many as 50 to 60% of all pregnancies end in miscarriage, with the vast majority of these losses occurring in the first trimester. This means that for every 2 pregnancies, one may not continue to term. This statistic isn't meant to cause fear, but rather to provide context and reassurance that if you've experienced this, you are profoundly not alone. It's a shared, though often unspoken, part of the human reproductive journey for many. The overwhelming cause of these early losses is not something a woman did or didn't do. It's actually rooted in genetics. Around 60 to 70% of early miscarriages are the direct result of chromosomal abnormalities in the embryo. A healthy human embryo requires exactly 46 chromosomes, 23 from the mother and 23 from the father, to develop correctly. If an embryo has too few or too many, or if a chromosome is structurally damaged, it simply can't develop into a healthy baby. This is essentially nature's way of making sure that a pregnancy that isn't viable doesn't continue, a kind of biological failsafe that's beyond anyone's control. It's also crucial to acknowledge the role that maternal age plays in the likelihood of these chromosomal issues. As a woman gets older, the quality of her eggs can decline, making chromosomal errors during fertilization more probable. This is a natural biological process. While a woman in her 20s has a certain level of risk, this risk gradually increases for women in their late 30s and becomes more significant for those in their 40s. Understanding this link helps to demystify why miscarriage happens and correctly places the cause on complex biology rather than on any perceived failure on the part of the expectant mother. The most commonly recognized signs of a potential miscarriage are vaginal bleeding and abdominal cramping. When these symptoms appear, it's totally understandable to feel immense anxiety and concern. However, it's really important to know that bleeding and cramping are also quite common in perfectly healthy, viable pregnancies. Many women experience some light spotting or cramping as the embryo implants into the uterine wall. So, experiencing these signs doesn't automatically mean a loss is happening. The most important step is to contact your doctor or midwife right away to get a professional assessment and rule out other issues, like a dangerous tubal pregnancy. One of the most reassuring indicators during this uncertain time actually comes from an ultrasound scan. If your doctor is able to detect a fetal heartbeat, the odds of the pregnancy continuing to term increase dramatically. In fact, even with some vaginal bleeding, if a clear heartbeat is visible on an ultrasound, about 95% of those pregnancies will result in a healthy baby. This powerful statistic can offer a significant glimmer of hope amidst the worry. It really underscores why seeking medical evaluation is so critical. It can provide clarity, and in many cases, profound reassurance that everything is progressing as it should be, even with alarming symptoms. While most miscarriages are caused by random genetic events, certain lifestyle factors can increase the overall risk. And these are things that are, to some extent, within our control. Smoking cigarettes, consuming alcohol, and having a high caffeine intake have all been scientifically linked to a higher incidence of miscarriage. Similarly, being significantly overweight or obese can disrupt hormonal balances and impact the uterine environment, contributing to an increased risk of pregnancy loss. Acknowledging these factors isn't about placing blame, but about empowerment, since it gives women tangible steps they can take to optimize their health for a future pregnancy. It's equally important to dispel the persistent myths about what causes a miscarriage, because these falsehoods can create unnecessary guilt and anxiety. Everyday stress, having sex during pregnancy, regular exercise, and using birth control pills before you conceived do not cause a miscarriage. A minor fall or a gentle knock to the abdomen is also highly unlikely to cause a pregnancy loss in the early stages. Interestingly, experiencing morning sickness is actually associated with a lower risk of miscarriage, suggesting a healthy hormonal environment. Letting go of these myths can really free women from a heavy burden of self-blame and help them focus on what truly matters. For many women and their partners, the question of when to try to conceive again is, honestly, one of the first to come up after the physical and emotional storm of a miscarriage has passed. For a long time, the standard medical advice was to wait at least 3 months before attempting another pregnancy. But, recent scientific evidence has challenged this traditional guidance. Newer studies have shown that there isn't really a physical benefit to waiting. In fact, some data suggests that couples who conceive again within the first few months after a loss may actually have a slightly higher chance of a successful, full-term pregnancy. The new thinking is that couples can begin trying to conceive as soon as the woman feels physically recovered and emotionally ready. From a purely biological standpoint, ovulation can return very quickly, sometimes within just a few weeks of the miscarriage. The key is to listen to your body and your heart. There's no right or wrong timeline, and the decision is deeply personal. For some, trying again quickly is a way to heal and look forward with hope. For others, taking more time to grieve and process the loss is essential before starting the journey of pregnancy again. It's completely normal to feel a mix of hope and anxiety when you decide to try again. The innocence of a first pregnancy is often replaced by a heightened awareness of everything that can go wrong. This is a common and valid emotional response to loss. It can help to find a supportive doctor or midwife who understands your history and can provide extra reassurance during the early weeks of a subsequent pregnancy. Many women find that an early ultrasound to confirm a heartbeat brings immense relief and helps them to begin to connect with the new pregnancy with more confidence and less fear. Remember, having one miscarriage doesn't mean you're destined to have another. The vast majority of women who experience an early pregnancy loss, even 2 or 3, go on to have healthy, successful pregnancies and deliver healthy babies. The odds are overwhelmingly in your favor. If you've experienced 3 or more consecutive miscarriages, this is classified as recurrent pregnancy loss, and it's recommended that you seek a specialist evaluation to investigate potential underlying causes. For most, though, a miscarriage is a sad but isolated event on their path to parenthood. While it's true that most early miscarriages caused by chromosomal issues can't be prevented, you can take proactive steps to create the healthiest possible environment for a future pregnancy. This preparation should ideally begin before you even start trying to conceive. If you smoke, quitting is one of the most impactful things you can do. Eliminating alcohol and reducing your caffeine intake to a moderate level are also crucial steps. If you're overweight, working towards a healthier weight through balanced nutrition and regular exercise can significantly improve your hormonal health and lower your risk of complications, including miscarriage. Once you become pregnant, the focus naturally shifts to what can be done to protect the developing baby. It's important to have realistic expectations. There's very little that can be done to stop a miscarriage that's already in progress due to a genetic problem. Old-fashioned advice like strict bed rest hasn't been shown to be effective and is no longer routinely recommended. Similarly, while reducing extreme stress is always good for your overall well-being, everyday stress hasn't been proven to cause miscarriage. Some doctors may prescribe progesterone supplements, but evidence for their widespread effectiveness is limited, though they are generally considered safe. The most powerful tools for prevention during pregnancy are straightforward and consistent. Attend all your antenatal appointments, take your prescribed prenatal vitamins, especially folic acid, and maintain open communication with your healthcare provider. Your prenatal vitamins provide essential nutrients that support healthy fetal development from the very earliest stages. Regular checkups allow your doctor or midwife to monitor your health and the baby's progress, catching any potential issues early. Don't hesitate to ask questions or voice concerns. Being an active participant in your care is empowering and beneficial for both you and your baby. Finally, please hold on to this truth. You are not to blame, and you are not alone. Experiencing an early miscarriage can be a profoundly lonely and heartbreaking event, but it's a path that countless others have walked. Allow yourself to grieve, Seek support from your partner, friends, or support groups. And be gentle with yourself. The journey to building a family can have unexpected detours, but for the vast majority of women, it ultimately leads to the joy of a healthy pregnancy. Focus on the positive steps you can take, trust in your body, and look to the future with hope.